Hello friends, let us now learn some important points about the prokinetic agents. These prokinetic agents are actually central D2 receptor inhibitors. So normally dopamine will inhibit acetylcholine at the smooth muscles. So these prokinetic receptors, these prokinetic agents. So one more important thing is because these will block, these prokinetic agents are D2 blockers which will inhibit dopamine, and thus after inhibiting dopamine acetylcholine will get increased and this will increase motility. Whereas one more important thing is metaclopramide and domperidone. Metaclopramide will, then we have D2 receptor. Now D2 receptor also activates on CTZ and thus causes vomiting. So D2 receptor inhibitor can also be, can inhibit chemoreceptor trigger zone, and this is used in vomiting. So if you see the uses of this D2 receptor inhibitors, we can use these D2 receptor inhibitors in nausea, vomiting, constipation, diabetes mellitus, gastroparesis, and post-operative gastroparesis. So if you see the side effects of prokinetic agents, these are the metaclopramide side effects include, these causes extrapyramidal side effects like dystonia, akathisia, and it also causes Parkinson's disease. It causes dystonia, akathisia, and Parkinson's disease. This also increases the prolactin and thus it causes gynecomastia, and it also causes galactorrhea by increasing the prolactin levels in the blood. Then the next important thing is this drug metaclopramide. Metaclopramide will activate 5-HT4 receptor and thus increases the motility of the drug, whereas this metaclopramide also inhibits 5-HT3 receptor also. Now these prokinetics are actually central D2 receptor inhibitors. Next if you see the prokinetic agents, in this first we have cholinomimetic agent. In the cholinomimetic agent we have neostigmine. Neostigmine is acetylcholinesterase inhibitor which increases acetylcholine. The use of neostigmine is it causes colonic pseudo obstruction in hospitalized patients, and thus it can be used in Auger-Lewis syndrome, whereas erythromycin will activate motilin receptors and thus it increases motility. So this erythromycin can be used off label as diabetes mellitus, gastroparesis. Then we have prucalopride. Prucalopride is a 5-HT4 agonist, and this prucalopride can be used in constipation dominant inflammatory bowel disease. It can be used in constipation dominant inflammatory bowel disease, and it can also be used in diabetes mellitus, gastroparesis. Then the next important thing is 5-HT4 agonists. 5-HT4 agonists include cisapride and mosapride. This cisapride and mosapride, both these are withdrawn due to cardiac side effects. These are 5-HT4 agonists. Then we have dexloxyglutamide. These dexloxyglutamide are cholecystokinin A antagonist, and these dexloxyglutamide will increase the motility. These will increase the motility. Then this motilin agonist, if you see the derivative, motilin agonist is the derivative of erythromycin. This includes metamcinal and camicinal. This metamcinal or camicinal are the drugs which are under trial, and these are the drugs which are derivative of erythromycin, and these are motilin agonists. Then we have the next drug which is Rasika Dauteril. This Rasika Dauteril is an enkephalin opioid, and this, because it is an enkephalin opioid, it decreases the motility and causes constipation. This enkephalin opioid, in the presence of the enzyme encaphalinase, this is metabolized. Normally if you see the enkephalin opioids, normally in Ricadotril Rasika Dauteril is a drug which is Encephalinase inhibitor. It is an Encephalinase inhibitor. Normally, the enkephalin opioid, in the presence of encaphalinase, it is metabolized. These enkephalin opioids will decrease motility and they cause constipation. So, if you inhibit this encaphalinase in the presence of the drug Rasika Dauteril, then obviously this the enkephalin opioid will increase and thus it decreases the motility. Then the next drug which is important is we have encaphalinase inhibitors. We also have encaphalinase inhibitors. These encaphalinase inhibitors will increase the constipation. These will increase constipation and they have anti-motility action. And these encaphalinase inhibitors are also anti-secretory. The use of this Rasika Dauteril is it causes secretory diarrhea and it also causes it is used in, I'm really sorry, the uses are, it is used in secretory diarrhea and it is also used in diarrhea dominant irritable bowel disease. Then we have tegaseroid. Tegaseroid is a drug which is withdrawn from India due to increased myocardial infarction and stroke episodes. So these are the important prokinetic agents which are used for, these are actually used for constipation, right? So this Rasika Dauteril which we are seeing, one more important thing, this Rasika Dauteril and tegaseroid, these are not prokinetic agents. The prokinetic agents are only till motilin agonists, whereas this Rasika Dauteril and tegaseroid, these are actually, this will decrease the motility. Okay, so thank you guys for watching.